the progress of patients treated for certain chronic inflammatory disorders such as pulmonary tuberculosis, rheumatoid arthritis, polymyalgia rheumatica, and temporal arteritis are monitored through the determination of erythrocyte sedimentation rate of these patients. What are even erythrocyte sedimentation rate in the first place? Well, that is exactly what we are going to talk about in this video. I trust you've been having a great time. Welcome once again to Joen Academy. In this video, we'll know what erythrocyte sedimentation rate is all about. We will also know how erythrocyte sedimentation rate is determined. We will know the normal values of erythrocyte sedimentation rate in males and in females. Variations of erythrocyte sedimentation rate will also be looked at. We'll also talk about the significance of determining erythrocyte sedimentation rate. Finally, factors which affect erythrocyte sedimentation rate will be discussed in this video. Alright guys, let's have fun. The erythrocyte sedimentation rate is just the rate at which erythrocyte settles down. Normally, the erythrocytes, which are commonly called red blood cells, remain suspended uniformly in circulation. This is actually called suspension stability of red blood cells. If blood is mixed with anticoagulant like EDTA and allowed to stand on a vertical tube, the red blood cells gradually settle down. This is because of gravitational pull on the standing blood. After the red blood cells must have settled, a supernatant layer of clear plasma is left. Erythrocyte sedimentation rate is also known as sedimentation rate or SED rate, or you can call it Bernacchi reaction. Erythrocyte sedimentation rate was first demonstrated by Edmond Bernacchi in 1897. How can we determine the sedimentation rate of an individual? Well, there are two methods that can be employed in the determination of erythrocyte sedimentation rate. We have the Westergren Method and the Wintrobe method. Let's talk about each of these methods one after the other. Firstly, the Westergren Method. The Westergren Method is carried out using Westergren's tube. And Westergren's tube is a tube that is 300 mm long and it is opened on both ends. It is marked 0 to 200 mm from above downwards and can only be used in the determination of erythrocyte sedimentation rate. The procedure for this method is that 1.6 ml of blood is mixed with 0.4 ml of 3.8% sodium citrate and it is loaded in the Westergren's tube. The ratio of blood and anticoagulant, which is sodium citrate, is 4:1. The Westergren's tube is then fixed to stand in vertical position and left undisturbed. At the end of 1 hour, the reading is taken. Wintrobe's method is carried out using Wintrobe's tube. It is a short tube that is open only on one end. This tube is 110 mm in length and 3 mm in size. The unique thing about Wintrobe method is that it is not just only designed for the determination of erythrocyte sedimentation rate, it is also designed for determination of packed cell volume. Wintrobe's tube is marked on both sides. On one side, the marking is from 0 to 100 and it is for erythrocyte sedimentation rate determination. And on the other side, the marking is from 100 to 0 and it is for packed cell volume determination. Procedure for this method is about 1 ml of blood is mixed with anticoagulant. This time around, it is ethylene diamine tetraacetic acid, which is EDTA in short. The blood is loaded in a tube up to 0 mark and the tube is placed on Wintrobe stand. It is left for about 1 hour before the reading is taken. Let's look at the normal values of erythrocyte sedimentation rate of individuals according to the two methods that we just described earlier on. Firstly, by Westergren's method, the normal erythrocyte sedimentation rate of males in this method is 3 to 7 mm in 1 hour. In females, it is 5 to 9 mm in 1 hour. In infants, it's about 0 to 2 mm in 1 hour. By Wintrobe's method, the normal values of erythrocyte sedimentation rate in males is from 0 to 9 mm in 1 hour. And for females, it is about 0 to 15 mm in 1 hour. Then, in infants, it is about 0 to 5 mm in 1 hour. There could be variations from the normal values of erythrocyte sedimentation rate. This variation could be in normal condition or in pathological condition. Erythrocyte sedimentation rate is less in children or infants than adults because of more number of red blood cells. Erythrocyte sedimentation rate is more in females than in males because females have less red blood cells than males. During menstruation, erythrocyte sedimentation rate tends to increase because of loss of red blood cells. From the 3rd month to patrician, the erythrocyte sedimentation rate increases up to 35 mm in 1 hour because of homodilution. Let's have a look at the pathological variation of erythrocyte sedimentation rate. In diseases like tuberculosis, all types of anemia except sickle cell anemia, malignant tumors, rheumatoid arthritis, rheumatic fever, and liver diseases, erythrocyte sedimentation rate tends to increase. Whereas in conditions like Pepton's shock, polycythemia, sickle cell anemia, allergic conditions, and severe leukocytosis. There are decrease in erythrocyte sedimentation rate in such conditions. Determination of erythrocyte sedimentation rate is of great importance clinically. It is not costly to determine, and it is really helpful in diagnosis and as well as prognosis of diseases. Diagnosis of disease simply means detection of presence of diseases, whereas prognosis means monitoring the cause of diseases and response of the patient to therapy. Factors like specific gravity of red blood cell, relapse formation, increase in size of red blood cell, viscosity of blood, and red blood cell count all affect erythrocyte sedimentation rate. Increase in specific gravity of red blood cell increases erythrocyte sedimentation rate because red blood cells are heavier and tends to sediment faster. Relapse formation increases erythrocyte sedimentation rate. Relapse formation is the linking of red blood cells like chains resembling stacks of coins. Globulin and fibrinogen accelerates relapse formation. When the size of red blood cell increases, erythrocyte sedimentation rate also increases. Increase in viscosity of blood decreases erythrocyte sedimentation rate because the more the viscosity of the blood, the more difficult it will be for red blood cell to settle. Increase in red blood cell count brings about decrease in erythrocyte sedimentation rate because the blood becomes more viscous in increase in red blood cell count. Thank you so much guys for watching this video. Please share with your friends and subscribe. See you next time.